We got Dr. Kumar with us this morning. We're talking about a diabetes drug, but first, follow up on a story from last week about vertigo.
Yeah, I didn't get a chance to cover some of the things that the viewers may be aware of. There's other treatments for vertigo, including physical therapists, audiologists, ENT physicians, and so that's true. It was a good feedback that there's other people that are out there that can help people with vertigo.
Yeah. Well, let's talk about this diabetes drug. A diabetes drug may soon be available for weight loss. It's called Tirzepatide, the active ingredient in the diabetes medication Mounjaro. It can help patients lose weight, according to trial data. Apparently, the manufacturer is asking for FDA to approve it for weight loss. Talk about this. Is this safe?
Yeah, there's already a couple of drugs out there that are working in that regard. Wegovy and Ozempic are the brand names of semaglutide, which is the molecule. Wegovy is just 3 times the doses of Ozempic. And, here recently on the Oscars, Jimmy Kimmel made a joke about, like, everybody looks great. They're all on Ozempic because they've all lost weight, right? Yeah. And so, these drugs that were used to treat diabetes, Ozempic particularly, and Wegovy is the only FDA-approved drug for semaglutide to lose weight. And it works. We've talked about this about a year ago about Wegovy. Now, this is a new medication that's on the market that's asking for FDA approval that will also work, we believe. Mounjaro has one of the exact same compounds as Ozempic and Wegovy, but it also acts on another receptor. And while they claim that the combination of the two receptors makes it more effective for weight loss, one trait that all these 3 medications have in common is that it reduces gastric motility, or how well the stomach squeezes. And I bet that that's a major contribution to how and why people lose weight.
Yeah, and you said that's not talked about a lot. Is it kind of an ick factor? Do people not realize that that's what's happening, or?
Yeah, it's hard. It's unclear. I think that they prefer to promote the receptor action. Maybe it looks better, maybe it sells better, without commenting that one of the common effects is that your stomach doesn't squeeze as well. And if your stomach doesn't squeeze as well, you're not going to be able to eat as much, and therefore your caloric intake is going to drastically reduce. And once it reduces, then you're going to consume less calories and you're going to lose weight. And Mounjaro, Wegovy, Ozempic, they all do that. And the tricky thing with all 3 of them is that as soon as you stop taking it or you miss a dose, the effects on all of the hormone effects will decrease, but certainly the one that stops immediately is the effect on the way your stomach squeezes. Your stomach will squeeze normally, and you won't feel crummy eating more calories, and your calorie consumption will go up. And what's universal is that once you stop the medication, your weight goes up. And that's the tricky aspect about all of these medications, is that you have to stay on it forever, and forever is a pretty long time, as Prince would say.
Yes. Assuming that the FDA does approve this for weight loss, is this for everybody?
Well, it depends. I mean, it's so far, we've had just several years trial study, and it appears safe, so far for a couple of years. It's hard to know what the long-term effects are. What happens when these drugs are used for 5 years, 10 years, 15 years? We don't have that kind of data. We don't have that kind of experience. But for the short run, it's gonna work. It's safe. It's effective at least in the short run of years. 1 to 2 years. We don't know the long term. Of course, the tricky thing about it is the part where if you stop it, your weight comes back, right? So, but we're on other medications all the time. Just tell you my own history. I got a thyroid disorder, right? So I'm on a thyroid medication, and I'm going to take that foreseeably the rest of my life. And I don't have a problem with that, And so it may be something that people don't have a problem with, that's taking it the rest of your life in order to get your weight down. And we don't have the data yet, but one will presume it's coming, that keep getting your weight down will improve your cardiovascular risk factors, improve a whole host of risk factors for heart disease and stroke, that it may be the best thing for billions of Americans in a country that has a rising epidemic of obesity.
Yeah, there you go. If you've got a question for Dr. Kumar, email us at askdrkumar@gmail.com. You can check out his website, drkumar.com. Thanks, Doc. Be right back.